Half the world gets headache every year. Most are harmless, but some can be fatal. Is your headache just from stress or something more serious? Here are the red flags that can save your life. I'm Dr. Rehan Pradhan, MD in Internal Medicine. Today, I'll walk you through the signs of headaches, when they are harmless, and most importantly, when they're medical emergencies. Headaches are incredibly common. Nearly everyone experiences them at some point of time, and it is one of the most common reasons people seek a doctor. In fact, according to the World Health Organization, around 50% of adults globally report having a headache at least once a year. Let's start with a surprising fact. The brain itself can't feel pain. That's right, the brain has no pain receptors. So why do you get headaches? The pain actually comes from the structures around the brain, such as the meninges, the brain's protective layers, blood vessels, nerves, scalp, and muscles. When these structures are inflamed or irritated, they send signals that our brain interprets as pain. Key structures involved in headache transmissions are trigeminal-vascular system and trigeminal-cervical complex, along with ventro-posterior-medial thalamus and cortex. Most headaches are harmless primary headaches, such as tension type or migraine. While these can be painful and disabling, they are usually not life-threatening. This diagnosis is based on entirely patient history, and imaging like CT scan or MRI of the brain rarely helps. But once in a while, headache can be a red flag of something far more serious. For most people, headaches come and go without even needing a hospital visit. The doctors always watch for the secondary headaches, which are caused by an underlying disease like an infection, bleeding, or tumor. To identify these, clinicians use a set of red flags which can be memorized by the common memory aid Snoop. Systemic symptoms like fever or weight loss, or secondary risk factors like cancer or HIV positive status. Neurological symptoms such as weakness, numbness, confusion, or seizure. Onset, which is sudden, especially a thunderclap headache that peaks within seconds. Older age, especially more than 50 years, as a new headache could mean a vascular problem. Progressive headache, or headache which changes with posture, or papilledema, which indirectly implies brain swelling. Eyes are windows to our brain. Retina is the only part of human body where we can see the nervous system directly. The fundus, the back inner wall of our eye, is the only location where blood vessels can be visualized externally. To see this swelling of the optic disc, that is papilledema in your retina, the doctor might shine light with an ophthalmoscope. Of all the red flags, the most feared is the sudden severe headache, often described by patients as the worst headache of their life. This could be a sign of subarachnoid hemorrhage, which happens when a brain aneurysm bursts and bleeds into the space around the brain, called the subarachnoid space. It is often associated with neck stiffness, vomiting, or even loss of consciousness. This condition is fatal if missed and requires immediate emergency care. To help identify patients at risk of subarachnoid hemorrhage, emergency doctors use the Ottawa SEH rule. It applies to the people over 15 years of age with sudden non-traumatic headaches with maximum intensity within the first hour of onset. It includes age which is more than equals to 40 years, thunderclap headache, neck stiffness or pain, witness loss of consciousness, headache during exertion, or limited neck flexion on physical examination. If any of these are present, further tests like a CT scan or a lumbar puncture are needed to rule out subarachnoid hemorrhage. This tool is highly sensitive and helps doctors avoid missing dangerous cases while preventing unnecessary scans for others. So when should you seek a medical help for a headache? If it is sudden and severe, especially if you have never had one like that before, get checked. If it comes with fever, vision changes, weakness, confusion, vomiting, or follows a head injury, don't delay. And if you are over 50 years of age experiencing a new or changing headache, it's worth getting evaluated. The good news about headache is most primary headaches are preventable. Simple lifestyle changes make a big difference. Stay hydrated, maintain a good sleep hygiene, and take screen breaks and reduce eye strains. Learn to manage stress through mindfulness or exercise and avoid common headache triggers such as skipping meals, alcohol intake, strong smells, loud environments, and too much of exercise. For disabling recurrent primary headaches, there are many abortive and prophylactic treatment options. Avoid self-medication with regular analgesic use, rather consult a medical doctor. In summary, while most headaches are not dangerous, it's important to recognize the red flags. Don't just suffer in silence, snoop around for the red flags. When a headache feels sudden, unusual, or disabling, don't ignore it. Your body is trying to tell you something. Listening can save your life. Share your experience about headaches in the comments below. If you found this video helpful, share it with your loved ones. You never know, the life you might have saved can be of someone you love. Thanks for watching. Stay mindful, stay pain-free, and I'll see you in the next video.